Good afternoon, everyone, and welcome to today's COVID-19 update. Today we have Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw.
Thank you, Chris, and good afternoon, everyone. Over the last 24 hours, we have identified 5,384 cases of COVID-19 and completed about 13,879 tests. Our positivity rate for lab-confirmed COVID is about 38%. There are currently 635 people being treated for COVID-19 in hospital, including 72 in the ICU. I want to note that starting today, our historical ICU numbers may look a little different for a few dates in the past. As we have been doing continual quality assurance work with our data, it was identified over time some units in some hospitals have shifted back and forth between being available for use as an ICU unit or a non-ICU unit. In some of our historical data, patients admitted for COVID treatment were categorized as being in ICU when the unit they were on, in fact, had been changed back to a non-ICU unit at that time. The adjustments you will see in historical data today now reflect correctly the type of care those patients were provided. This means you will see a decrease in ICU numbers at some points in time, with a corresponding increase in non-ICU numbers. The updates do not change the significant pressure that the system has experienced in each of our previous waves. This is simply an adjustment as we continue to be committed to transparency in our reporting. Sadly, 6 new deaths have been reported to us since January 6th. My deepest sympathies are with the loved ones of these Albertans and anyone else who has lost a loved one, no matter the cause. With our recent increase of Omicron cases, demand for PCR testing has pushed our testing system beyond its capacity. As many Albertans have found, just getting an appointment for a swab takes several days, and the time to get results back is now close to 48 hours after the swab is taken. While we have used widespread PCR testing to manage COVID-19 in previous waves, this approach is just not possible with the Omicron variant. In order to ensure that patient care decisions are supported by timely diagnostic information, PCR testing eligibility will now be focused on those with clinical risk factors for severe outcomes and those who live or work in high-risk settings. Effective immediately, PCR tests will be available for only those in specific categories. The full list can be found on our website, but some examples include continuing care residents, healthcare workers and staff in acute and continuing care settings, shelters, and correctional facilities, symptomatic household members of a person who works in continuing or acute care, individuals with any degree of symptoms who have risk factors that would make them qualify for monoclonal antibody treatment if positive for COVID-19. This list is available on the website and includes those with significant immunocompromising conditions. All residents and workers from isolated and remote First Nations, Inuit, and Métis communities, returning international travelers who become symptomatic within 14 days after their arrival so we can monitor for new variants, and hospital or emergency department patients of any age who were ill enough that COVID testing would change treatment plans. I want to specifically note that going to an emergency department does not make someone eligible for a PCR test. So please do not go to emergency unless you are sick enough to really need urgent treatment. Going for mild symptoms will not make you eligible for a PCR test. This change is not unique to Alberta. All other provinces, including but not limited to Quebec, BC, and Ontario, are currently limiting their PCR testing programs to specific categories to help manage with the Omicron wave. In fact, we are asking those who are not eligible for PCR testing, who do not fit in one of the categories I have just outlined, to please cancel testing appointments that may have previously been booked. Please call 811 or go online to cancel your testing appointment. It's not enough to simply not show up, because that slot could be used for a critical, high at-risk case, and only by actively canceling your appointment can you make room for them. The Omicron variant is so prevalent in our communities right now that if you have COVID-19 symptoms, such as a stuffy or runny nose, cough, fever, sore throat, or loss of sense of smell or taste, you should assume you have COVID-19 and are legally required to isolate. Please stay home and away from others for 5 or 10 days, depending on your vaccination status, or until your symptoms improve, whichever is longer. You can take a rapid test if you have one, but for most people with mild illness, a test is not necessary, and symptoms can be managed at home. AHS has updated their COVID assessment tool to help Albertans determine whether they need and are eligible for a PCR test, what type of care to seek based on symptoms, and how to take care of symptoms at home with appropriate support. The tool is available at ahs.ca/COVID-screen. It should be used even before you call 811. This is a screening version for adults, and one for children will be available later this week. If you are otherwise healthy and without risk factors, please use the screening tool and rapid tests if available to confirm your symptoms and self-isolate and manage your illness at home. If you need further information on how to manage COVID-19 at home, AHS has also developed a guide available at ahs.ca/COVID self-care. In addition, the Alberta Medical Association has a resource available on their albertadoctors.org website under COVID-19 that can help determine when you may need to talk to your doctor. It is not always necessary to get in touch with your doctor, as most people with mild symptoms can manage at home with no problems. Please have a look at the resources available to you if you're feeling sick to know what best to do. I want to take a moment to thank the many Albertans who have taken care to stop any further spread of COVID-19 lately. Many people are staying home with mild illness and taking precautions to protect their communities even without testing. Thank you for your continued efforts, safeguarding of others, and allowing the PCR testing system to deal with the more critical and at-risk cases. That said, we are aware that many Albertans are still being asked for a documented positive test result for their employers or sometimes schools. We know that many Albertans are presenting their rapid test results to physicians so they can obtain a doctor's note they are being asked for to document their absences. With the rapid spread of Omicron, it is not feasible for everyone who is sick or who tests positive on a rapid test to call their family doctor. To make it easier for those who want to document a positive rapid test result, we have worked with primary care colleagues and adapted a printable PDF form similar to what is being used in other jurisdictions. Patients can use this form to enter their name, the time the test was taken, and other useful information that might be needed if they are asked to show a positive result. I want to emphasize that I urge employers and organizations to not require proof of a positive COVID-19 result to support sick leave requests right now. With our test positivity currently at 40%, anyone who has COVID symptoms almost certainly has COVID and should just be staying home. However, if people want a more formal way to document a positive rapid test result for their own use, after printing the document available on our website, you can fill it out and take a photo of your rapid test result so you can choose to share this with whomever you wish. The printable form is available on alberta.ca. Again, to be clear, this is an optional tool that patients can use to document their rapid test results for their physicians or others who may be asking for this information. However, this printable PDF for at-home rapid test results does not replace privately paid rapid tests and cannot be used for the purposes of the restriction exemption program. I also want to express my appreciation for primary care colleagues across the province who have been working tirelessly to respond to the Omicron variant. I am deeply grateful to all my colleagues on the front lines in all settings, and we will continue to do our best to incorporate their feedback into our response. One of the most critical parts of our response continues to be immunization. The evidence we're consistently seeing is that vaccines continue to be the best defense against COVID-19. Omicron appears to be milder in large part because it's infecting people who were already protected from severe outcomes through vaccination. Booster doses have been shown to strengthen protection against getting infected with Omicron and any severe outcomes from COVID-19. This third dose is also a critical part of our efforts to prevent our hospitals and ICUs from being overwhelmed with new cases of COVID-19. The rapidly increasing number of cases could get to a point where more people will be admitted to hospital with COVID in the near future. Even if only 1% of cases are in hospital, that's still a tremendous burden on our healthcare system. That kind of surge has the potential to overwhelm our healthcare facilities, not to mention the healthcare providers who have been working tirelessly and nonstop for nearly 2 years. We must take Omicron seriously. Fortunately, we are seeing a positive uptake on third vaccine doses. On January 3rd, Alberta surpassed 1 million booster doses. That's more than 1 million people who are committed to helping each other and getting to the other side of this pandemic. I'm encouraged to see so many Albertans doing the right thing. Help us reach another million boosters and help protect yourselves, your families, and your communities. I say again that we must take Omicron seriously. It is not too late to act. Thank you, and I'm happy to take questions.
Thank you, Dr. Hinshaw. We'll now move to the media Q&A portion. Operator, can you put through the first caller, please?
Thank you. The first question is from Lisa McGregor, Global News.
Thanks for taking my question, Dr. Hinshaw. What's the threshold in terms of cases or perhaps ICU rates or whatever to make perhaps changes to testing or to staffing at facilities just as we move forward in the weeks to come?
I'm sorry, could you clarify what types of facilities you're wondering about?
Well, what's the threshold? I mean, today we have a certain amount in the ICU. There's more cases again. You know, has there been any talks with the government of just what's next moving forward, and if it hits a certain mark in terms of ICU or cases that you'll start making changes or restrictions?
I'm not able to speak on behalf of elected officials with respect to restrictions. With respect to testing, that is exactly one of the reasons that we are making the change we are today, which is that we have to focus our testing capacity on those for whom that result will make a difference to their care, which is why we need to strategically use our existing testing capacity for those who are at high risk or work or live in high risk settings.
Lisa, do you have a follow-up?
Yes, I do. So in that case, in the next couple of days or couple of weeks, if things are more tailored to testing those individuals, is there a threshold where there's maybe a plan B in terms of dealing with this?
It's very clear that our cases are higher than they've ever been before, and it's clear that our hospitalizations are beginning to rise. Again, the questions about thresholds, ultimately we're looking at all of the impacts of COVID-19, but questions around decisions on restrictions are not ones that I can answer.
Operator, please put through the next caller.
Bill Kaufman, Post Media.
Yes, Dr. Hinshaw, would you happen to have any numbers on the number of healthcare workers who are sidelined by COVID-19, and I mean, just how big a challenge is this, coming to be for the healthcare system?
We've never seen this kind of transmission before, and in every sector, worker absenteeism is an issue, particularly, of course, in the healthcare sector where the pressures of increasing visits to emergency departments, increasing admissions are beginning to be seen. I don't have the details on current absenteeism right now, but we know we've heard that, of course, as transmission increases, there are more people who are off sick. And so that's one of the reasons that we used the available evidence on duration of infectious period for those who are fully vaccinated to shorten our incubation period to try to help with some of those pressures. But this is a challenge that, again, we all can do something about by getting every dose of vaccine that we're eligible for, by staying home when we're sick, and ultimately, again, following all of the restrictions to minimize as much as we can. We can't stop this, but we still can slow the spread.
Bill, do you have a follow-up?
Sure do. Yes, Doctor, we're hearing from some people in the community, perhaps out of cynicism, perhaps out of frustration, and they look at the return to school of our children, and they don't believe they're being protected sufficiently. there's a view that that Alberta is basically kind of just giving up on this, and we're reverting to attaining herd immunity to defeat or at least to wind down the pandemic. I mean, what can you say about that?
Making decisions about in-person schooling is not straightforward, especially with the Omicron situation. We have always tried very, very hard to keep kids in school, and similar to colleagues in BC, and I've discussed this at length with colleagues in BC, where we know that there are significant impacts to kids' health if we keep them out of school for long periods of time. So there is no perfect answer, unfortunately, and right now with the return to school at the time of high transmission, there will be occasions where individual schools, individual classes will need to move online for periods of time simply for operational reasons. However, I believe that, again, when we can't, there's no perfect solution. We need to look at that balance and making sure that kids have an opportunity to go back in person where the school system can receive them, increasing the protections. So when it comes to enhancing the quality of the masks that are available to kids and teachers, providing rapid tests so that there can be asymptomatic screening done, those are additional levels that we can offer. But again, similar to colleagues in BC, we've weighed all of those things and determined that we want to offer kids the opportunity to go back, even though we know there will be some operational challenges. We'll have to focus responses on areas where unfortunately we are seeing that local impact, but to deprive all children across the province of that opportunity to go back again is a significant health risk as well. So in this environment, we're trying to do the best we can to balance all of those competing interests.
Operator, please put through the next caller.
Sheila Insulsky, CTV.
Hi, Dr. Hinshaw. Thanks so much for taking my question. Leaked internal modeling over the weekend shows the possibility of an overwhelmed healthcare system in less than 2 weeks' time. What are you and the health minister doing to avoid this scenario?
I continue to provide recommendations as I always have, and it's my belief that we need to prepare for significant impact at this point, given the cases we've seen, and I wouldn't be able to speak on behalf of the health minister.
Helen, do you have a follow-up?
I do. Today, the official opposition, the NDP, are calling for the release of daily forecasts outlining 2-week modeling for ICU and non-ICU hospitalizations. Can you speak to why this information isn't being released publicly?
I'm not aware whether or not decisions have been made on public release, so I'm sorry, I can't. I'm not sure whether or not that decision has been made.
Operator, please put through the next caller.
Carly Robinson, City News.
Hi, Dr. Hinshaw. You started your update today talking about case counts, but as we test less and less people, what is this number really telling us? So I was hoping today you could give us your professional opinion and estimation of how many people are currently infectious with COVID-19 in Alberta today.
I wouldn't have the ability to give a specific number. I think it's clear that there are many more people with COVID than are being diagnosed, partly because of the changes to eligibility that were necessary so we can focus PCR testing on those at highest risk, but partly because many people have very mild symptoms. And as we know through previous waves, not everyone comes forward for PCR testing. So I think it would be fair to say that in previous waves, we've seen a range. I think I've mentioned catching 1 in 4 cases with PCR up to about 1 in 6 in the 4th wave. I think it would be very conservative estimate to say we're 1 in 10 or greater at this point in time in terms of the number of cases that we're catching, which again is why it's so important for everyone to assume that anywhere they go, there's going to be someone infectious with Omicron. And to be very clear, that's not to say that we should stop trying to slow the spread. I believe that's very important to slow the spread to protect the healthcare system. and it does take actions on all of our parts to do that. So again, I couldn't give a specific number, but it's very clear with a 40% positivity rate that transmission is higher than it's ever been before. And we should assume that at minimum, we're seeing about 10 times or more the number of cases that we're diagnosing through PCR.
Carly, do you have a follow-up?
Yeah, I was just wanting to get your opinion on early public health messaging with Omicron, classifying it as mild. Do you think that has a role in where we are today, just a few weeks later, with maybe people sort of wrote it off because it was mild, and now we're here with our hospitals at the verge of who knows what?
It's an interesting question. Personally, when asked about Omicron, my answer would always be that it doesn't matter if it's milder at an individual level. If it's more infectious, it will be a concern at a population level. So I think that the early indications from South Africa that individual level mildness was a trend that was being seen, I think did have some impact on people's willingness to respond. And at the same time, my perspective would be that the colleagues that I've spoken to, and certainly in all the messaging that I've put out, have consistently been that we can't look just at an individual level. We must continually look at that population level, because ultimately it's the population level that puts the burden on our healthcare system.
We have time for 2 more questions. Operator, can you put through the next caller, please?
Thank you. Hamdi Isawi, Star Metro.
It's post-media, but Dr. Hinshaw, you listed some of the people who are eligible for PCR testing, and I remember a few weeks back you said PCR testing is only recommended for certain groups of people. Is today the day? Are you saying today that certain groups will be ineligible or will be refused PCR testing if they don't meet those criteria, or the types of people that you mentioned earlier?
That is the change that we're making. So on December 23rd, we had indicated that if people had access to a rapid test and that test was positive, that only those who had risk factors would be recommended to get a confirmatory PCR test. But those who didn't have access to a rapid test could still go for PCR testing no matter what their characteristics. So the change we're making today is that those who are not in the list of either high-risk individuals or high-risk settings are no longer able to book a PCR test, even if they don't have access to a rapid test. We're working hard to make rapid tests more widely available, but I think it's critical to note that this shift has been made by every other province in the country. Certainly the large ones, BC, Ontario, Quebec, have needed to limit PCR testing in this way because of the transmission in the community and because we're having significant challenges in getting timely access to testing and results for people who really need it to manage their clinical scenarios. And that's why, unfortunately, today we do need to make this change.
Hamdi, do you have a follow-up?
Yes. Regarding the documentation you mentioned before, that people can upload some sort of photo and get some sort of documentation to prove that they've had COVID-19 in some way. Will that be provided on their healthcare records, or would that be done through a separate process?
So the PDF form that we're making available is simply a tool for an individual to document their results for their own use. We are not able to validate at-home rapid test results, so we are not going to be able to put that into the formal health record system. This will be something that an individual who has a rapid test, who tests positive, they can utilize that form to document the time that they took the test along with that rapid test positive result. However, again, this is something for their own private use. It would be their own piece of health information, and it would not be something that would be uploaded into their electronic healthcare record.
Operator, please put through our last caller.
Jesse Weisner, Global News.
Hi, Dr. Hinshaw. Thanks for taking my question. I'm wondering, if we need to take Omicron more seriously, why aren't more restrictions being put in place?
Decisions about restrictions are not mine to make.
Jesse, do you have a follow-up?
Yeah, absolutely. So I'm wondering about large venues. Why are large venues like arenas that are currently limited to 50% capacity, but still allowed to seat people shoulder to shoulder? Do you recommend they put social distancing policies in place?
It would be best practice to do mandatory distancing in those types of venues. Currently, if a facility is under the restriction exemption program, they are recommended to space people with at least 2 meters between households. However, that isn't required within the restriction exemption program. At this point in time, though, with Omicron and the high infectivity, that would be a best practice in terms of a recommendation. I should add that if an arena is not in the restriction exemption program, they would be required to keep that distancing between households.
Thank you, Dr. Hinshaw. That concludes today's COVID-19 update. Have a good afternoon, everyone.